Let's talk about COPD, chronic obstructive pulmonary disease. First, identify what COPD is, how prevalent it is throughout the United States, how it affects your body, how it presents with symptoms, how you're diagnosed, and then treatment, management, and prevention of the disease. So COPD stands for chronic obstructive pulmonary disease, and it's a blanket term that can mean a couple things, which we'll get into. So COPD by itself is kind of a blanket term. And what it implies is either you have something called chronic bronchitis, or you've had a lot of bronchitis infections throughout your lifetime, or you're diagnosed with something called emphysema. And this is done by testing with PFT tests, CT scans, x-rays, spirometry, other things that your pulmonologist or primary care doctor help to identify. So approximately 12.5 million Americans have COPD throughout the United States. So think about your lungs as being part of a tree. So the trunk of the tree is more of the bronchus, okay, or the rigid pipe of bringing air into your lungs. And then the branches and the trees and the flowers and the leaves of the tree are kind of what they're thought of as more the alveoli. So there's a more detailed description of what your lungs are in the anatomy lecture. So think about as you breathe in, with inspiration, air comes into your lungs, your diaphragm moves down, and your lungs expand. And as with the expiration, your diaphragm moves up, pushing the air out of your lungs and out through your nasal cavity. So what happens specifically with COPD is that you have an inflamed process in the trunk of the tree, or the bronchioles, the rigid pipes that bring air into your lungs. And that becomes chronically inflamed, where on the right-hand side, you see how the air surface or the narrowing of the bronchial tubes creates some obstruction or less airflow going through. This is why it's considered what they call an obstructive pulmonary condition with inflamed bronchial tubes. So oxygen moves into your alveoli through the bronchus, where the gas exchange into your capillary system. This is better described through the anatomy lecture. So what are the symptoms of chronic obstructive pulmonary disease, or COPD? So most people develop a wet cough. So they're coughing up a lot of mucus. They become short of breath because that narrowing of the bronchial airway. Because of the constant coughing, and people get fatigued. They have some chest tightness, some wheezing. So the wheezing is kind of like a whistling sound as they breathe, or they feel like there's a lot of collection in their lungs, which there is. And a lot of people get sometimes ankle swelling because their heart has to work a little bit harder in order to get blood, oxygenated blood to the rest of their system. So we mentioned earlier, part of COPD can be caused from something called emphysema. And emphysema is when you get the air sacs, or the alveoli, they start to break down. So you have something called surfactant, which helps keep the integrity of the alveoli together. But on the left-hand side, you see healthy alveoli. On the right-hand side, you start to see how it gets broken down. And when the walls of the alveoli get broken down, you start to lose a blood supply. And what ends up happening is you have these empty chambers, or alveoli sacs, or that just kind of collect air. And this air isn't used for anything. It's just CO2 that's kind of left in your system, which your body doesn't get rid of. And so you end up with excessive air, or air trapping in these alveoli. And when you have mass amounts of these alveoli in your lungs, it can be called what they call blebs. Which is a bunch of these alveoli that are collecting just dead air that can't be used for anything. So a lot of the breathing goes into this dead air space, which it can't get transferred into your bloodstream. So how is COPD diagnosed? So you can do it through a number of different ways. A pulmonary function test will look at your lung volumes, and then how fast you can expel your air. Spirometry is another type of test that is kind of a smaller function of the pulmonary function test that's often done in your primary care doctor. office. X-ray will help to identify if there's any sort of air trapping or sometimes fluid in your lungs. And a CT scan is a much more, or even a high resolution CT scan will also help to identify specific abnormalities going on in your lungs. So a pulmonary function test, or a PFT, helps to identify COPD. It measures a bunch of different things, but one thing in particular it measures is something called FEV1, which is the amount of air that you move out of your lungs in 1 second. So you should be able to move 80% of their air out of your lungs within 1 second. If you can't, then that identifies that you have some sort of obstruction that's limiting the amount of air that can be pushed out of your lungs. So once diagnosed with COPD, they look at your FEV1 as what staging you are. So in gold, they call it the gold standard staging for COPD. FEV1 above 80% of predicted is considered a mild case. If it falls between 50 to 80%, it's a moderate, and then below 50 is severe. And then very severe is actually less than that, which is less than 30% of predicted, which indicates end stage COPD. So correlating the severity with symptoms, typically when you have mild symptoms of COPD, you might get short of breath with kind of higher levels of exercise, climbing stairs, walking quickly. Moderate intensity of COPD is a little bit more advanced, where you can get it with just simple walking around, and you have to kind of catch your breath every couple minutes. When it gets more severe, you get more shorter breath with less activity, typically maybe doing dishes or standing for prolonged periods of time, getting dressed, undressing, bending over. A lot of people have problems breathing, bending over. That's called bendoapnea. Very severe people will get start to develop severe like heart failure because their heart's overworking because it's trying to push more blood into their system to get more oxygen. And people get short of breath with very minimal activities, typically just at rest as well, just sitting there. So what are some causes of COPD? So primarily COPD is caused from exposure to smoke. So if people are smokers, I think 80% of smokers or 80% of COPD patients are caused from smoking. It says 75% in this case, but the data shows varying degrees. Exposure to environmental pollutants. So if you live in an area that has high pollution, you're more susceptible to getting COPD. There's something called alpha-1 antitrypsin deficiency. So this is something that people are born with, that you lose some of the protective mechanisms when you're born, and this alpha-1 antitrypsin is something, if you don't have, your body is much more susceptible to developing COPD and lung breakdown. Treatment and management of COPD. Number one, quit smoking. That's the number one priority for anybody if they're continuing to smoke while they have COPD. Number two, exercise helps to improve vascular flow and efficiency of delivering oxygen to your body. Number three, making sure that you have adequate oxygen levels in your system. If you fall below 88%, you're able to get supplemental oxygen delivered. Ideally, you want your percent to be above 90% at rest and 92% with exercise. Prevention of exacerbations. So exacerbations happen when your CO2 level goes up and you can be hospitalized because of that. Management of staying healthy, eating healthy, staying away from sick people are all ways that you can prevent exacerbations. If in severe cases, if you develop a lot of emphysema, you can develop or you can have surgery for that, where they actually remove part of the lung that's diseased, allowing for better airflow going to the healthier tissues. Valve implants are kind of a one-way valve that allows air to just go in one direction and eventually deflates the diseased part of the lung. And then eventually lung transplants with very severe cases. In other cases, people will use what they call positive airflow pressure devices. And a lot of times this is prescribed for people with sleep apnea. However, it also helps to manage people with COPD because it helps regulate their breathing better, keeping their CO2 levels between the 35 to 45 or below 35%. So how can you identify if you're getting a flare up? Well, if you develop increased shortness of breath or increased mucus production, this is an identifying factor that your condition is getting worse. If you develop wheezing when you normally don't have it, if you develop a wet cough, chest tightness, and you can develop other cardiac things like ankle swelling, heart rate increase, the rate of breathing. If you feel like your breathing is shallow and you're not getting enough air in, okay? If your oxygen levels or CO2 levels, when you measure it with your pulse oximeter, is below what it normally is. If you develop a fever, if you have, desaturating oxygen levels. So those are all identifiers that you're possibly getting a flare up for COPD. So what are some things you can do to help prevent flare-ups or help to manage it if you get one? So number one, getting the flu shot will help to lower your risk of getting the flu, okay? Avoiding people that are sick, washing your hands on a regular basis. A lot of times this is an underutilized activity that can really help prevent disease. Wearing a mask around people in high concentrated areas. And then if you do feel like you're getting a flare-up from the slide mentioned before, call the doctor immediately. And then also monitor your oxygen with a handheld device. The other thing to mention as well is mucus production. Most people with COPD have mucus, and it usually should be clear, whitish, yellow. If it changes in color to like a green, a brown, that's indicating that you have an infection brewing. So that's something that the doctor will need to know so they can put you on an antibiotic rather quickly.